So today we are going to start your next revision, and this is back of the upper limb. From this chapter, it is actually a very short chapter and it has a few important topics. So let's start our marking. First of all, they're telling you the superficial landmarks. These are only and only for reading. Nothing is very important to be asked, and not a single question has been asked from this area from the prof point of view. However, you can just give it a read for surface landmarks, but this is not very important. Skin and fascia of the back, the next topic. This topic also doesn't hold any value of SEQ or MCQs. It is only and only for reading, so you can skip it. Next, we go to the muscles connecting the upper limb with the vertebral column. Yes, these muscles are very important. Their origin, insertion, and each and every aspect of this muscle is important. But you have to do this muscle table from Snell. I recommend you to do this muscle table from Snell because the muscles are very well organized from the Snell. As you can see in BD, they must have given the names, but prefer to do this muscle table from Snell, and they are important. Next are the additional features of the muscles. You don't have to give them a read. You can skip it because the muscle table is way more enough. Next question we have is our triangle of auscultation. For triangle of auscultation, this is a SEQ. It has been asked in a past paper once, and you have to do its boundaries actually and its significance. Two things from this paragraph you have to do is boundary and significance. For example, it is bounded medially by the trapezius muscle, laterally by the scapula, and inferiorly by the latissimus dorsi. The floor is formed by 6/7 rib and 6 intercostal space and rhomboid major. And next is its significance. Cardiac orifice of the stomach lies deep to the triangle, and days before X-ray were discovered, the sounds of the swallowed liquor were auscultated over this triangle to confirm the esophageal tumor. This is its significance. You have to memorize it. I will send you a diagram of this topic from your book, so you can memorize it from there, because you won't be, if you cram it, you won't be able to grasp it for a longer time. So to have a concept of it is important, and I will give you a diagram of it. Next is a lumbar triangle of Pettit. Lumbar triangle of Pettit. Lumbar triangle of Pettit is again an important SCQ. It has been asked once in a past paper, and likewise that you did for this question, you have to do for this one. You have to know the boundaries as I marked. Like lumbar triangle is another small triangle, sorry, must be bounded medially by the latissimus dorsi. Medially by the latissimus dorsi, laterally by the external oblique muscle of the abdomen, and inferiorly by the iliac crest. And its significance is about the occasional hernia at this site is called lumbar hernia. The significance of this point is that it can be a site of lumbar hernia. So you have to do this. Next important things are facts to remember of trapezius muscle and serratus anterior muscle called overhead abduction. You have to know these. I already have given you explanation in the pectoral region. When I started pectoral region, I gave you assignment of the muscle table, a muscle connecting the upper limb to thoracic column and vertebral column, and you know that I have sent some guideline of muscle there. Second, names of the muscle, their action, it is highly important. Next will be the clinical anatomical problem. For this, you have to do this clinical anatomical problem, clinical scenario, and pink boxes are always important. So this completes our back region.